everyone, and thank you for joining us for September's edition of Health Bites with Region 3. We're pleased to welcome back this month our featured speaker, Nina Dacko. Nina has had a passion for working with insects ever since she was very young. She obtained her bachelor's in science degree in entomology from the University of Illinois in Urbana-Champaign in 2006, and a master of science in environmental toxicology from Texas Tech University in 2011. She has studied mosquitoes and been involved in mosquito surveillance and control activities in Illinois, California, and Texas since 2006. Nina has previously presented with us for Region 3 back in February of 2019, so we're really excited to have her back. And in today's Health Bites, she'll give a presentation on mosquito and vector control awareness, bridging the gaps between mosquito and vector control programs between public health, medical and veterinary professionals, politicians, and the publics. So thank you everyone thank you again, Nina, for being our guest speaker this morning. Thank you everyone for joining us, and I'll be turning it over to you to take us away.
Good morning, everyone, and thank you for coming to Health Bites, and thank you to all at Health Bites who invited me back to speak about this very important issue about mosquito and vector control awareness. And so I'm going to jump right in since she already did read the title of this presentation. So what I'll be talking about today particularly is awareness, also what mosquito and vector control programs do, perceptions surrounding mosquito and vector control, perception of chemistries because we work with them, also people who might be involved with mosquito and vector control, structures of programs, how we work with our elected or appointed officials, and also what we're doing with Gulf South Vector since I'm a part of their collaboration. And so I am going to start by saying that I in particular have worked a lot in mosquito control, and so it's going to be more mosquito control heavy than vector control. So I'll start by just giving that as a caveat. So awareness is a big part of this presentation. And so I wanted to start by explaining a little bit about awareness. And so if you go to dictionary.com and you look up the word awareness, you'll get a definition. And it's the knowledge or perception of a situation, concern about the well-informed interest in a particular situation or development. So two of the main words that you're going to notice in that definition include knowledge and perception. And those things are not the same thing. So I wanted to highlight what knowledge and perception are and what are the differences between those. So knowledge can be thought of as facts, information, and skills acquired by a person through experience or education, the theoretical or practical understanding of a subject, awareness of a familiarity gained by experience of a fact or situation. So knowledge is really what folks that work directly with mosquito and vector control are going to have. And while we wish that everyone in the public would be knowledgeable about what we do, that's not always the case. And so we're going to focus on the other definition now, which is perception. Perception is the ability to see, hear, or become aware of something through the senses, a way of regarding, understanding, or interpreting something, a mental impression. And so the word impression kind of stuck out to me, and I decided to look that up. Again, not quite the same as knowledge, which is also like I said, based on facts or information or skills, mental impression. So the impression is an idea or feeling or opinion of something or someone, especially one formed without conscious thought or on the basis of evidence. So as we can see here, this is not the same, again, as may not be based on facts. So ideas, feelings, opinions come into play here. So an opinion is a viewer judgment formed by something not necessarily based on fact or knowledge. The beliefs or views of a particular majority of people about a particular thing, estimation or quality of worth of something. And so we end up coming up with the word worth. And the worth is equivalent to a value. And so I kind of created a roadway from awareness to worth. If we have folks who are not aware of what we do, they will not see the worth in what we do. And so knowledge is what we strive for. That's what we would love for everyone to have when we deal with a lot of people who aren't working with mosquito or vector control and aren't aware of it. In reality, we're dealing with perceptions, impressions, and opinions about what we do. And those are going to be surrounding everything that we use. And I'm going to talk a little bit about pesticides a little later. So first off, what is mosquito and vector control? And hopefully some of you are returning and have watched the presentation that I have. That's has a lot more to do with what mosquito and vector control programs are, but I need a reminder slide. So at its most basic level, it's a program whose main goal is to reduce contact between people and mosquitoes or other vectors to improve quality of life and protect residents within the program's jurisdiction from vector-borne illness. So that being said, our goals are not to kill every single mosquito out there. That's one, it's impossible. Two, we wouldn't want to do that. We want to reduce the burden of mosquitoes from both quality of life to vector-borne illness. And we do this through practicing integrated pest management practices. The idea of integrated pest management, which I could give an entire presentation on by itself, is just the idea of using every tool in your toolbox and also to gather data through surveillance and make sure that we are making science-based, data collected and driven decisions on when we're actually making a control activity. And so that involves not only different chemistries, but also educating folks that are in the public, as well as other folks we may work with. And again, we make our decisions based on surveillance. And those practices are best described through the best practices for integrated mosquito management. That is actually a guide that's on American Mosquito Control Association's website. If you do work in mosquito and vector control, or even want to know just a bit more about it, I encourage folks to read that guide or look at the webinars that were put together that describes that guide. It's a really great resource. So there are also a lot of different reasons for mosquito and vector control. They end up popping up as programs. And the most obvious reason, of course, I'm going to pick on Texas since that's where I am. Harris, Dallas, and Tarrant counties all have mosquito control programs that were in response to some kind of disease. So in the mid-60s, Harris and Dallas counties both had St. Louis encephalitis virus outbreaks. And then Tarrant County, even though they had a bit of a program, really expanded their program post West Nile virus outbreak in 2012. And so these programs arose as a response to disease activity. There may also be mosquito or vector control programs in response to tourism, because let's face it, no one likes mosquitoes. And so if you're going to have a lot of people visiting somewhere, the state of Florida comes to mind, or New Orleans and other places that are visited on a regular basis. Tourism is going to drive some mosquito control activities so that people are not driven away by mosquitoes if you have that kind of problem there. Also, citizens are going to complain because mosquitoes can be nuisances, and then they'll call up maybe a city council member or a county commissioner, and they'll complain about it. And so that's a directive. This is especially going to be true in areas that are prone to flooding, say around some kind of river basin, for example, or coastal regions. I mentioned Florida before. You probably could not live in the state of Florida if there was not appropriate mosquito and vector control there. And so there are a lot of programs in the state of Florida, also along the coast in California and even in Texas. Also, there may be agricultural practices like rice farming, for example, that's very water heavy. They produce a lot of mosquitoes, and so you need to keep the mosquitoes down in those types of areas. And also there might be infrastructure. Maybe you have an open sewer ditch, for example, and that's going to attract and breed a lot of mosquitoes, and you need to take care of that. And of course, all of these things, when there are a lot of mosquitoes, especially if there's maybe a new invasive in your area, it does get press coverage. The news folks love to talk about mosquitoes because, well, they're annoying and people want to get rid of them. So a lot of people will think about mosquito control, and they're going to think about things like a plane in the air, or maybe ULV spraying on the back of a truck driving around. However, there's a lot of different things that go into mosquito and vector control, and a lot of knowledge. It is very multidisciplinary. We may use skills from entomology, epidemiology, chemistry. We need to make sure we're communicating with folks correctly with our communication. We do test for agents, and so we're involved with laboratories. And of course, we're bound by laws. And so when we're talking, as mentioned before, integrated pest management, one of the first steps is identifying your pest. And that takes entomological knowledge. And so a lot of folks that are involved, like myself, love to do mosquito identification or other vector identification to make sure that we know where they're coming from. So we also need to know biology of these mosquitoes. So whether they're coming from a tree hole or a roadside ditch or a hole left on the coast by a crab, for example, we need to know where these mosquitoes are actually coming from so we can be sure that we're using integrated pest management approaches. When it comes to epidemiology, these mosquitoes can be infected with viruses. And so we have to do things like calculate the infection rate. That's what that MLE stands for, is maximum likelihood estimate. VI is vector index. And those are just fancy forms of calculating infection rates of mosquitoes multiplied by the population so that we can see what the risk is and then compare that to a human case epi curve down the line. When we talk about chemistries, we have to know about pesticides. Pesticides are chemicals, and so we have to have a pretty good understanding of chemistry. We can also deal with, if you're using the same chemistry over and over and over again, it tends not to work, just like antibiotics become resistant or bacteria become resistant to antibiotics. Mosquitoes can become resistant to pesticides. So we need to make sure that if we are implementing some kind of response, that we're going to have something that works. So folks will look at resistance. And then we also want to be stewards of our environment. And that's going to happen with the more knowledge about chemistry that we have. When we talk about communication, there are some words that can be triggering. Pesticide is one that I've said many times, and a lot of people will kind of cringe up and they don't want to hear that word. And so we encourage different words like treatment, for example, when we're communicating with folks. We do not want to get misinformation out there. When we're dealing with laboratories, we do detect agents that cause disease through different methods, be it PCR or ELISA, which are just assays to detect these. We could also potentially do genomic sequencing, seeing where the mosquitoes, where they've come from, for example, is a really great way to detect that. And we're also bound by laws. Again, I mentioned pesticides because we work with them. The Federal Insecticide, Fungicide, and Rodenticide Act is one of the laws that states that we need to read the label and follow our proper protective equipment that we should be using. Endangered Species Act, we want to make sure that we're not harming our non-targets. Clean Water Act and National Pollution Discharge Elimination System, local ag and health codes. There's just a lot that goes into this. So a lot of knowledge has to be had by the team that's doing mosquito and vector control work. So along with that knowledge is a lot of different items. And I'm not going to sit here and read this slide off to you, but I'm going to highlight a few different things. As mentioned before, we perform surveillance, either to get the abundance of mosquitoes that we have or to see what kind of pathogens they might have in them. And so we're using things like mosquito traps, and we have freezers to knock down the mosquitoes or store them, dissecting microscopes to make sure that we're doing identification properly. Things that we use to pin insects so that we can make a reference collection and make sure that we can train those in the future. You may have a laboratory, which requires lab equipment and beakers and microcentrifuge tubes and things of that sort. We need skilled personnel to be sure that they can run this type of equipment. We need, our adulticides and larvicides. Adulticide just means a insecticide that will target an adult insect, in this case, an adult mosquito, or larvicide will target those larvae. We need all of those things and ways to apply them and vehicles to apply them. We also need to make sure that we're collaborating with people and have contingency planning, because sometimes when an emergency happens, for example, like a hurricane or a flood, we collaborate with contractors who may be able to carry out additional work that we'll need done. And of course, we need our databases and statistical analyses, again, to make sure that we are making data-based decisions when we're doing control. And so with all of that knowledge and all the equipment, I just wanted to highlight a basic org chart. Shout out to Placer. Thank you for supplying this organization chart for me. This is not just a one-person job. It's not just a part-time job of one person. It can be very robust. And when you have an efficient and effective program, we've got 26 professionals, and this is like a medium-sized program in the state of California. And so all the way from the district manager, who's the person who kind of communicates what the program is doing with the board of trustees, all the way down to a technician that may be going out and looking for larvae and treating those spaces where larvae are. We just have a whole group of people who are knowledgeable about mosquitoes, and they may have specific jobs within that. All right. So kind of jumping gears a little bit, there are different types of programs. So I just shared one that was an independent special district where we have many people contributing to mosquito control activities. We may have other programs that are within your local health departments or within your public works departments, or maybe it's in roads and bridges. And these programs are all different, and they have different levels of efficiency within them. And NACHO, or the National Association of City and County Health Officials, decided to put out a survey, and this is after the Zika outbreak happened. And so they put out a survey that kind of measured programs' competencies. And so they came up with 10 competencies, 5 core competencies, and 5 supplemental competencies that demonstrate the basic capabilities of integrated pest management and everything that I've been talking about, and how to carry out mosquito and vector control. And so our 5 core competencies include routine mosquito surveillance and routine control activities, whether you have larviciding and adulticiding capabilities. Species specific, meaning that you're actually identifying those species and then applying some certain methodology that will be specific to that species. Pesticide resistance testing. And so, we need to make sure that what we're applying out there is actually working. And then supplemental competencies include licensed personnel, whether or not you have something that's not pesticide driven, so a non-chemical vector control, maybe it's biocontrol or land management, for example. Community outreach, are you educating the folks in your community? And are you communicating with your local health departments about your surveillance and epidemiology activities? Are you sharing information? And then also, are you cooperating with nearby programs? Because mosquitoes do not know borders. So it's really great to know what the neighboring mosquito program is actually doing with you. So on the top was the survey that they put out in 2016. On the bottom was a survey they put out in 2020. And what they were finding is that there's different capabilities based on where these mosquito control programs were actually located structurally within government. And overwhelmingly, the thing that I'm going to point out on both of these surveys is that mosquito control districts who had dedicated personnel seem to be the ones that were a bit more capable, whereas other programs definitely need improvement. However, that's not the whole story. It's not all the information, because we need to look at laws that are in place, and we need to look at funding that's available for these programs. And so we'll be getting to that in just a little bit. All right, something interesting, because I'm going to switch gears and talk about perception a little bit, is I put out a Facebook poll. And for those of you in podcast land, you cannot see my slide, but I'm going to highlight this a little bit. On the left-hand side of the screen, I have a couple words that are in green. In the middle, I have many words that are in blue. And on the right-hand side, I have a few words in red. Green being associated positively with mosquito control, red being associated negatively with mosquito control, and the blue words are kind of somewhere in the middle. The size of the words that are on the screen are actually comparable to how many times they were said throughout this poll. Now, I do need to mention that since this was on my own Facebook, and I had a couple colleagues that also posted this on their Facebook, this is a little biased towards folks who know a thing or two about mosquito control, but I also have plenty of friends who don't know anything about mosquito control, as well do the others. And so words that continuously came up in this poll were standing water. I must mention that when a word is highlighted here, there might be other words that were used associated. So like with standing water, for example, there were standing water and tires. It was mentioned a lot. Spray truck, aerial treatment, that was all within spray. people were associating sickness with mosquito control, and what they were naming was the diseases that those mosquitoes actually carry. Personal protection is something that people know a lot about because they're used to going to the store and seeing your repellents that you could potentially use. Poison and cancer was also mentioned in on the negative end. On the positive end, prevention, part of public service was mentioned. Intervention being that it's going to be effective. And on the negative side, we have ineffective. And some people even said my name because they know that I'm associated with mosquito control. But it was kind of eye-opening to see the main things that are associated. The words standing water, sickness, personal protection spray, those kept coming up over and over. And so it's kind of nice to see where our messages are actually getting out. We do have support for mosquito control as given by the National Public Health Framework for Prevention and Control of Vector-Borne Diseases that was put out by CDC in the very early part of this year. And they definitely have support for mosquito and vector control activities because as our climate is changing, a lot of mosquitoes and other vectors are actually expanding their ranges. And so we're getting new diseases in areas where we didn't think that they would ever be before. And so there's also some research that's out there, particularly Catherine Dickinson's work and others that worked with her. Basically what she did in Texas, Florida, Wisconsin, I think Arizona was actually mentioned in there, and in some other places, were willingness to pay. So how much is a person willing to pay for mosquito and vector control activities? And, you know, a lot of these are very interesting. In Texas, nearly 80% of folks throughout 3 different regions of Texas were willing to pay $50 a year for mosquito and vector control activities, at least. In Florida, you know, she also did some studies in Florida and Arizona. And what she found is that even though West Nile virus was out there, it's really, you know, people still want that pest control for the mosquitoes. So if they were a nuisance, even if they were able to carry, the nuisance was a big factor there. Also, you know, majority of people were accepting of genetically modified organism mosquitoes release throughout the Florida Keys. Richards and others in 2017 actually, again, kind of touched on that, whether it's vector or nuisance, when there wasn't a very robust program in the area, a lot of people would resort to calling a private pest control company. And so there were more treatments in those areas that didn't have a robust program privately. And then Warden Qualls put out an important paper in 2021 saying that you can't really separate disease and pest because, you know, folks, when they go out in the backyard and they're being eaten alive by mosquitoes, they're not necessarily thinking, you know, am I going to get a disease? They're thinking, man, that's annoying. I don't want this around there. I do also want to put regulators in our support category. We do need regulation. We learned this with DDT and everything that happened in the past with that. And so we work with our regulators quite often to make sure that they're aware of what we're doing. And we want them to really know that we have science-based thresholds, and you should have science-based thresholds. So if you don't, make sure that you do. All right. So while I was talking about the support, and particularly that between pest control and public health, these two things do overlap. And so I have a series of concentric circles where pest control is overlapping with public health here. And mosquito control and vector control are both pest control. They're within the sphere of pest control. And so not all mosquito control is going to be public health related or vector related. And that would be your nuisance mosquitoes. And then if it's mosquito control and it's public health, but it's not vector control, we still have emergency response type things. So like if you have a flood event, like a hurricane, for example, we need to make sure that we are protecting our responders. So we have the emergency responders, and then also those folks who are repairing down power lines, for example. We need to make sure that they can get the job done in a timely fashion. And a vast giant pool of mosquitoes coming after them, that's not really going to be great. And so there's a lot of implementation of mosquito control in emergency response. There is also pest control that's public health related, but it's neither mosquito nor vector control. And that would be in your sanitation. So think of things like filth flies, like bed bugs, like rodents. Those may not be related to vector control, but they're still in the public health realm. We call them pests of public health importance. And then, of course, within mosquito control, there is also vector control, and there's vector control that's not mosquito. And so I just wanted to highlight some relationships and why we might see people not able to separate those things. We do have opposition to mosquito control as well. We have some non-government organizational groups such as Pesticide Action Network or Centers for Biological Diversity or Beyond Pesticides. I want to highlight that though these groups are in opposition to any use of pesticides, we need to work with them to make sure that they're aware of the consequences of not having mosquito or vector control. We need to work with our folks who maybe don't believe in science as much. We should have science-based thresholds. And so unfortunately, we are going to have some people who are opposed to what we do because of that. We also have anti-government people and not on my yard folks. And so we still want to reach out to all of these folks. Chemophobia is a real thing. People are afraid of chemicals, even though the world is made up of chemicals. We have some folks who say taxes are bad. And so anything that's going to be coming out of a tax, like mosquito control, that's going to be a bad thing. And let's face it, though we would love for all the programs to be able to do this efficiently and effectively and competently, that's not always the case. There's going to be some folks who aren't doing it right, just like that within any field. And so we're trying to bridge the gaps between and among those programs. So on this side, because I just mentioned chemophobia and opposition and all these things, when I mention the word pesticide, most folks are going to think of this, and this is a person that's in full personal protective equipment. They have a Tyvek suit and they have a head covering, they have an apron, they have gloves, they have a mask that they're wearing, and they're spraying chemistries on a crop. And this is what people think about when I say pesticides. But they're not thinking of this, which is a picture of children enjoying an afternoon in a swimming pool, looking like they're having a lot of fun. And so you might be looking at this picture and thinking, well, what does this have to do with pesticide? Well, that water is actually treated with chlorine, and chlorine is registered as a pesticide with EPA because it is an antimicrobial, and antimicrobials are included in pesticides. As a matter of fact, we're going to talk a bit about pesticides. So first off, what's a pest? A pest is any kind of living being in the wrong place at the wrong time where you don't want it. And a pesticide is a formulation chemistry designed to mitigate populations of pests, usually through death or disruption of a life cycle. And so even though everyone thinks of an insecticide, it may include other things like preventatives, like your dog flea collar, for example. Systemics, that is a pesticide that's taken up by a plant so that the plant itself becomes toxic. You might have something that doesn't kill a pest, but it's an anti-feedant, so a bug won't feed on a plant. You could have a repellent like we use for our, DEET repellents or others that we might use. And antimicrobials. People don't think of putting bleach down on their counter as a pesticide, but it is. And it's similar, pharmaceuticals. So I'm going to kind of draw some parallels between pharmaceuticals and pesticides. And pharmaceuticals can be thought of as formulation chemistries designed to mitigate symptom through abnormal human processes, through symptom alleviation. And those can include a lot of different things as well. So maybe you have a medication, something that you're taking topically or internally. You may have vaccines. You may have diet pills. You may have prophylactics, hand sanitizers, and actual pesticides. So when we think about veterinarians, for example, that heart guard that you may be giving your dog is imidacloprid, which is an actual pesticide. So it can actually become kind of confusing when you're looking at these things. Well, which one's a pesticide and which one's a pharmaceutical? So there's a lot of similarities. They're aimed to improve quality of life, not only for humans, but also for animals, sometimes wildlife. Both are regulated by scientifically based agencies. They have various forms that they come in, and they may be given in point treatments or area wide. And they are multi-billion-dollar industries. And so some folks tend not to trust either one. They're intimately involved with chemistry, though. And so here are some other parallels when you actually look at those scientific-based agencies that I was looking at. Pesticides and pharmaceuticals are both regulated. Pesticides by EPA, pharmaceuticals by FDA. We have restricted use pesticides. We have prescription medications. We have general use things that you can buy at your big box stores. We have over-the-counter medications that you can get, a Walgreens or a CVS or something of that sort. We have area-wide application of pesticides. We have vaccine requirements, both in schools and military. Maybe there's fluoride in the water. We apply pesticides to the environment, whereas with pharmaceuticals, we're applying those to people or populations of people. For pesticides, we have an endpoint that is control of a pest. For medications, that's usually the endpoint is some kind of symptom mitigation. We have warning words such as caution or warning or danger on pesticide labels. We have schedules for drugs, schedule 1, 2, and 3 for narcotics, for example. Perceptions are usually pretty bad with pesticides, and perceptions are usually better with pharmaceuticals. I'm going to say better because I think we've learned from the last pandemic that perceptions can also be not so great with pharmaceuticals. However, what I wanted to demonstrate here was actually taking an excerpt, and this is from one of our NGO sites that is not very friendly to pesticides. And what I did is I actually took the word pesticide and I replaced it with medication. And just kind of hear how strange this sounds. Medication exposure can be linked to cancer, endocrine disruption, reproductive effects, neurotoxicity, kidney and liver damage, birth and development changes in a wide variety of species. Exposure to medicines can also alter an organism's behavior, impacting its ability to survive. In birds, for example, exposure to certain medicine can affect singing ability, making it difficult to attract mates and reproduce. Medicines can also affect a bird's ability to care for offspring, causing the young to die. For bees, even near infinitesimal levels of medications result in sublethal effect, impacting mobility, feeding behavior, and navigation. It sounds kind of strange when I say this with medications. However, with any substance, any chemistry, dose is what determines the poison. And so this can also be true with medication, though we don't think of it that way. All right. So with drawing these parallels, I purposely chose to draw parallels between our medical professionals. CDC had something called a roundtable, and this was for, again, the National Public Framework for Prevention and Control of Vector-Borne Diseases. And this was in Washington, D.C. And what they did is they invited professionals, be it doctors and patients, public health and vector control professionals, and also researchers. And they invited them to talk about this framework to see what they thought were important. And if you haven't looked in this framework, basically what they have is a series of 5 goals. And under those goals, they have strategic priorities, several strategic priorities, which I did not actually include on the slide. But we're going to go over the goals. So goal 1 is to understand when, where, and how people are exposed to vector-borne diseases, develop, evaluate, improve tools for diagnostics of vector-borne diseases is number 2. Develop, evaluate, and improve tools for prevention of vector-borne diseases, which is number 3. Develop and assess treatments for vector-borne diseases, number 4. Disseminate, implement tools, programs, collaborations to prevent, diagnose, and respond to vector-borne diseases is number 5. And within all of those, they have strategic plans. And the point of something that I personally learned from this roundtable was that they gave these little stickers and they said, place where you think things are important. We had a lot of people that were doctors and patients and researchers putting a lot of dots on things that were like vaccines or studying methods that we already have. And basically what I learned was when it came to vector control, actually going and responding to an outbreak, for example, people weren't putting dots under vector control. And so our awareness is definitely lacking in that portion. And all of these things are connected. And so it's really, really important that we get our medical personnel and our veterinarians and everything to understand that vector control is part of a bigger picture, which we're all involved in, whether it be directly or indirectly. So who do we work with? We work with public health professionals, particularly environmental health or EPI or emergency responders. We work with public works for land management. Veterinarians, as mentioned before, they deal with zoonotic diseases, so they deal with the animal side of what we're dealing with on the vector side. We've got medical personnel who are dealing with the patients. We have educators who need to communicate. We have elected officials. Those are the folks who are going to determine where funding from taxpayer money is going to. And then we have the public who votes for potentially legislation that's going to affect mosquito and vector control. And so we work with a lot of people, and we're all connected either directly or indirectly through the effects of vector-borne diseases and also just mosquitoes in general. So all these programs that could potentially be funded are funded at different levels, whether it be national, state, multi-regional. And so those are typically funded through the federal government and can trickle down to the states and even regions. We might have local tax assessment that's going to something like an independent special district. We may have programs that are within a city or a county department. We may have a division within a department, so like a division of public health, for example, or if we have a division within public works, for example, that might take care of mosquito and vector control, or we even have that within a division. So in a public health department, within the environmental division, for example, we might have a vector control program under there. And just realize that these programs may have different capabilities, and a lot of them have to go through different layers of the onion. In other words, I have to go to a manager of environmental health. That manager has to go through an associate director to a director to a county administrator to actually get to the folks with the purse strings. We need to make sure that we have people directly working with mosquito and vector control, talking to our folks who are holding the purse strings and determining where to put that money so that we get accurate messaging out to the folks who are knowing where that money is going. And also we need to communicate with our public because that's the voting portion of people who are also going to help determine where that money is going. So what if people aren't aware? And all of those people that I just mentioned working with, from public health professionals all the way down to the public, we could have missing links between what's going on with our programs and vector control to the EPI side of things, where we're going to determine how many human cases we have. If we're missing, if emergency responders aren't aware of what we're doing or why we're doing it during an emergency response, we may have impediment on those people who are going to fix the power lines that I was talking about earlier. If our regulators are not aware of what we're doing, they may be over or under regulating what we're doing. Because when I talked about pesticides, one thing that I was trying to get across here is that dose determines the poison. When we're working with a creature that's very small, like a mosquito, for example, we're using extremely small amounts of pesticide, and everyone thinks about agriculture, but it's just not the same thing. We're applying them in different ways and in different amounts. So just keep that in mind. Also, most importantly, our elected or appointed officials, again, they need to know what we're doing. And if they don't know what we're doing, we may end up with lack of funding. And of course, the public, which supports us, is going to make those elected or appointed officials aware of that. All right, so if there is a program around, what if it's not done correctly? Or what if it's not done effectively or efficiently or competently? We could have heightened risk for vector-borne diseases, be it human companion animal or wildlife. I do want to mention wildlife in here because that picture on the right-hand side, that's below the dog heart that's infested with heartworms. We've got the honey creeper from Hawaii, and that's actually an endangered species because of avian malaria. And so I don't think that folks think about wildlife getting mosquito diseases just like people will, and it has decimated their population. And now there's the last that I heard, maybe 15 birds left, and they've been almost wiped out by avian malaria. And so hopefully vector control can help with that. We also could end up harming non-targets or having human health exposures if we're not doing it right. We could have misinformation going out there. So information saying, maybe these repellents that are not EPA approved repellents, they work, but they don't. We don't want that happening. And we also don't want to throw away our taxpayer money. And so we want to make sure that what we are applying is effective. We may miss an invasive species that could potentially carry another disease or be a major nuisance, and we want to make sure that we're capturing those. So we need to make sure that we are getting support from our public. And also, if the public isn't getting these services, they're still going to do something about it themselves by going to private pest applicators. And we've learned that through some of the support research. All right, so finally, we're towards the end here, and I'm going to talk a bit about what I'm doing with Gulf South Vector. So what is Gulf South Vector? And as you see, Vector is actually in capital letters. Vector stands for Vector Education Center for Training, Outreach, and Resources. And so this was a center for training, basically, and it's come out of a grant supplied by CDC. And it's collaboration between private, public, and academic partners throughout the Gulf region. And so that encompasses states of Texas, Louisiana, Alabama, Mississippi, and Florida. We have our principal investigators, Dr. Claudia Reigel out of City of New Orleans Mosquito, Termite, and Rodent Board, and Ms. Janet Hurley from Texas A&M AgriLife Extension. And a whole lot of universities and a whole lot of different mosquito control programs. And what we're trying to do is we're trying to bridge gaps. As mentioned before, we have a lot of different mosquito control programs, placed in different departments or divisions or areas. And what we're doing is we're gathering information to see what those programs feel they need, because they're different depending on if it's an independent special district or one person that's been tasked part-time in an environmental health division of a public health department to go out and deal with mosquitoes. And so we asked some questions like, okay, if you had all the money in the world, what would you have? What kind of personnel would you hire? And we're also going out there and collecting where do we need to focus our energy? And so one thing that Gulf South Vector will also do, aside from looking at these needs assessments that we're actually going out, physically going to these programs and asking these questions, we're going to develop something that will help them. So some kind of informational pamphlets, maybe we need to put together presentations, and we need to connect all these folks that we work with, either directly or indirectly, and get them to be aware of mosquito and vector control. And so one of those focuses is going to be on elected and appointed officials to make sure that they're aware of what happens when you have or don't have a mosquito and vector control program, especially in the wake of diseases that are newly coming into our country or reemerging in our country, like dengue or Oropouche or other ones that have been mentioned. And if you haven't paid attention to Oropouche, pay attention. That may be the next one coming up. So with that, I do have a references slide. And then I can take questions if you all want to put up that questions slide.
I have a question, before people start adding their questions to the Q&A. I've heard some people are a little bit more susceptible to mosquitoes, like the mosquito will target, like you'll have a party and 3 people will be mosquito bait and 10 people won't. Is there anything that you know of? I've heard like vitamin B, maybe like a supplement you can take as a repellent. So do you know anything about that or?
So, yeah, I mean, you kind of asked a very complex question. And so this comes down to what are mosquitoes utilizing to get to people? Also, folks have different sensitivities between people. So between and among populations, folks are going to be more sensitive. So someone may be getting bitten 10 times, they only notice 2 of the bites, whereas someone who's bitten 10 times may notice all 10 of the bites. So there's one. Another one would be based on the bacteria on your skin is going to be attracting mosquitoes. And so every bacteria that's on your skin has a volatile chemistry, and those volatiles are drawing in mosquitoes. And so it has to do with the bacteria content on your skin. Additionally, there has been preferences towards different blood types, and that may have to be connected to the bacteria that's going to be on your skin again. But there are also things that you might be wearing, perfumes that you don't even know that you have, whether it be in your shower gel or a spray that you're putting on. So there are a lot of different things that could actually attract mosquitoes, and people themselves may just have some kind of fauna and flora on their skin that's very attractive to the mosquito. So that's a great and very complex question. All right.
Thanks for that. Yeah, it's always something I've wondered about. So yeah, put your questions in the chat for Nina. This is your chance to have a expert on that pest answer some of your questions or thoughts, or even just comments you might have.
Sure.
We did have one person say they're from they live and work in the Fingers Lake and Southern Tier regions of New York. And she wondered if you knew if anyone or a group that is doing similar work in upstate New York.
All right. So what I would encourage that person to look for is to see if there's a state association that actually lists the mosquito control programs, because every state has usually a list of programs. The other thing that I can encourage you to do is go to your local government page. Sometimes that will be within a public health or a public works department. And so what you can do is type in the name of your city, type in mosquito control, and see if anything pops up. And unfortunately, if not, there may not be, not every place has a program. Also check out local universities, because a lot of at least surveillance activities will be offered through the local universities. And so I know a fair amount of folks who work at universities who work not only on research with this, but also work on control activities. So that's what I would encourage that person to do.
And then someone also asked, is there anything natural that you can use? They use ivermectin, and I've also heard of using So Soft from Avon that works as a repellent. I've personally tried to use like rosemary essential oils and tea tree oils, but is there anything natural that we could use that would help, as a repellent?
Okay, so naturals may be something that's new and upcoming. As always, I would encourage folks to actually use EPA approved repellents. Those are the only repellents that have really gone through rigorous testing to make sure that they're effective and efficient. If you go to EPA's website, they have this great little tool. So like, let's say that you go to EPA and they have their own search, you can put in repellent and it'll come up with any active ingredient that they have that's EPA registered, and it will list that active ingredient and how long it actually is effective at what percent. And so I encourage folks to go on that website to look for that. There may be some naturals that are listed on there, but generally the naturals, unfortunately, there's a lot of folklore that's out there. So it's kind of hard to wade through like what's effective and what's not effective. And so I've got to go with the EPA approved repellents. I will say that there's been a fair amount of research done on catnip oils. However, realize that when people talk about these chemistries, let's say that, I hear a lot, citronella, I planted a bunch of citronella in my yard. Realize that even though citronella plants may have a chemistry that can be extracted and concentrated and put through certain chemical methods to extract some kind of chemistry that you can put on your skin, the plant itself doesn't naturally have that occurring. And so I'm going to caution folks against those naturals, because some of those times we just don't know at what dosage they're effective because they haven't been tested. So that's why we and CDC will all say EPA approved repellents. Okay.
So thank you. And then there's another one that says, is there any significant disruption to ecosystems when we diminish mosquito populations?
All right. So I also get this question a lot. And I would definitely say, because I am a bug lover, I'm an entomologist at my heart. And so I would love to tell you that, yes, they have some kind of role in the ecosystem, especially as larvae. There are a lot of different predatory insects that will eat mosquito larvae. Even mosquito larvae eat mosquito larvae. And so they're definitely a food source. As adults, not as much. There's a lot of information about, oh, bats and birds, they love to eat mosquitoes. However, bats and birds are really going to go for the most bang for their buck as far as energy expenditures is. If you think about energy expenditure, eating a mosquito is like eating a piece of rice to a bird, whereas a June bug is going to be a giant, big, juicy cheeseburger. And so they actually will eat mosquitoes, but they're going to concentrate a little more on those bigger insects. Now, if we were to remove all mosquitoes from the ecosystem, which is not the goal of mosquito control, by the way, I will have to say that's why we do our science-based data collected threshold for control activities. If we were to remove everything, we do have other bugs that kind of fill that niche, and that will probably fill that niche. So in a body of water where there's mosquito larvae, there are also other mosquito-like or chelicomorpha type insects. So things like non-biting chironomid midges, for example, will still be a food source for other creatures. So there are going to be other things that will hopefully fill that niche. But yes, I believe that they're an important part of the ecosystem.
And then someone else asked, what recommendations do you have for an organization that is just starting a mosquito surveillance program? As it can initially be overwhelming, sort of knowing where to start or just performing surveillance to know what diseases are out there.
Sure. So when just when just getting started, and this is actually not the easiest thing to do, reach out to those folks who know about mosquito and vector control, especially at universities. If you have some entomologists around, entomology is usually kind of the basis because we need to identify our mosquitoes in the area. And I didn't cover this because it's kind of another presentation, but Tarrant County alone, which is the county that I reside in, we have roughly 55 species of mosquitoes. And so all those live in different places, and we need to really start with identifying those. And then, you can look through your local legislation to see if there's any legislation that can allow you to start something like a district, or you may have a program within public health. The key here is that you need to understand that there's a lot of different professions that are involved here. And so networking is really going to be a great key to helping you get started and trying to find resources to do that. Also, again, you want to bring awareness about to your elected officials because those folks may be able to find a pot of money for you to work from.
Awesome. And then it looks like we have one last question before we wrap up. But someone asked, do you have any traps you would like to suggest for homeowners?
So again, I think that's kind of a complicated question. With traps, what you're actually doing is attracting mosquitoes. And even those mosquitoes that aren't going to be getting out of your trap, for example, you're still attracting mosquitoes to your yard that may not end up in the trap. So I caution anyone who wants to put traps in their yard. What is probably the most effective thing, like let's say that you're having a party out on your back deck, a fan, a box fan, a large fan. That's something that mosquitoes can't typically fly against, and it doesn't include chemistries. And so, fans are really great. There are thermocells and things of that sort. That's a spatial repellent, for example. Those are effective. Mosquito coils, they actually use the same active ingredient as other wide area repellents. And so, those are things that are a little more effective. So the wide area repellents and fans are probably your best friend. That's what I have to say about that.
And again, thank you so much for being our speaker today. I have a pollinator garden, so I particularly like the part about, pesticides, and nothing exists in a vacuum. So it's always weighing like what's going to be best for the plants, for the pollinators, for the birds, everything like that. So thank you again for being our speaker this month and for such a wonderful presentation. And thank you, Nina Dacko, for coming back today and with us and sharing your expertise with us. And we look forward to everyone joining us again for Health Bites next month. So thank you, everyone.
Thank you for the invite.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.